gather around. Somebody can sit back there if you'd like. Or not. Can everybody see? Is everybody okay?
Here, maybe I should sit back.
There we go.
No one wants to sit close to me.
So what I want to do now is give you an overview of the skeleton, give you some foundation for it, and give you some structure so you can kind of break it into different parts and hopefully help you understand it. So first of all, how many bones are we looking at here in the adult skeleton?
206.
206. And there's 206 bones there. And we can divide the skeleton, we can divide the bones up into two different parts. We have what's called the axial skeleton. The axial skeleton consists of the skull, the vertebral column, and also the thoracic cage. That's the axial skeleton. It forms the long axis of the body. And the other part of the skeleton is called the appendicular skeleton. Now, where did that word appendicular come from? Appendage. And what is an appendage? Appendage is something that you add on to something. So basically what we're doing is, well, the appendicular skeleton consists of the bones of the arms and the bones of the legs. And so we're essentially attaching the arms and the legs onto the axial skeleton, and that's why it's called the appendicular skeleton. And it's not only the bones of the arms and the legs, but it's the bones, or what we call the girdles, that attach them to the axial skeleton as well. All right, let's start up in the skull. This is the skull, and we can divide the bones in the skull up into two different parts. The first part is called the cranium, and all of this area that I'm feeling right now is called the cranium. And the cranium forms what we call the cranial cavity. What is a cavity?
Like a hole.
A cavity is an empty space. Okay? So the bones of the cranium form the cranial cavity. And that space isn't empty. What do we find in the cranial cavity?
Brain.
That's where the brain's at. Okay? So the cranium is providing protection for the brain. And there's a few different bones that form the cranium. These are all what we call flat bones. They're pretty flat, and they have a curved appearance to them. But as we go through these, let's go ahead and palpate them, one on yourself. So that's really helpful for me, is when we're going through these bones, to actually feel them on your own body. Okay. So here we have this bone in front that forms your forehead, and that's called the frontal bone. Okay. Then we have these two bones on either side. These are called the parietal bones. We have this bone in the back. That's the occipital bone. And then we also have this bone on the side, and this is where your ear would be. So it's right about there. And that's called the temporal bone. Now those names should sound familiar. Frontal bone, parietal bone, occipital bone, temporal bone. Why do those names sound familiar? How are these bones being named?
The same way the brain is named.
Same way the brain. So the lobes of the cerebrum are named the same as the bones that cover them. So the frontal lobe is right below the frontal bone. The parietal lobes are right below the parietal bone. Occipital lobe, where vision is processed, is right there, and the temporal lobe is where the temporal lobes are right underneath. There's a couple other bones that form the cranium. These are a little bit deeper. So you can open it up, and there you can see that cavity, or the lower half of it at least. This bone, which spans across the front, it forms part of the orbit. It forms part of the outside of the skull. It forms part of the nasal cavity. Anybody remember what that is? These contain the optic canals that the optic nerves pass through. That's the sphenoid bone. Okay, that's the sphenoid bone. And then right in front of it, there's a little sliver of it there, and there's a sliver of it in the orbit, and it forms a lot of the structure of the nasal cavity. That's the ethmoid bone.
Are these bones attached, like, I don't know, like hardened together, or is there a way for them to like slip apart?
That's a good question, and kind of where I was going next. So the location where two bones meet is called a joint. And there's different types of joints depending on the medium that connects them together. Most of the joints of the body, and basically all the joints that have movement associated with them, or a lot of movement, are called synovial joints. The shoulder joint, the elbow joint, the hip joint. And for all of these synovial joints, there's a fibrous capsule over them, dense irregular connective tissue, and they're filled with synovial fluid. And so that synovial fluid is kind of what links those bones together. Another type of joint, and these are the ones that we find in the skull, are called fibrous joints. And so they're basically held together by small, little, tough collagen fibers. And there's not a lot of movement associated with those. And that's what we're looking at here. And specifically the joints that hold the bones of the skull together are called sutures. Okay, these are suture joints. And they have a serrated appearance, kind of a jagged appearance. And so they link together, and then there's small little collagen fibers that are holding those together. And over time, these joints do ossify. So they turn to bone. And so it's just bone to bone that's holding them together. I think once you're in your 40s or something like that is when they fully ossify.
If it does like break apart at a joint, does it regrow back? Like those fibers, can they reattach? Sorry.
That's a good question. Yeah, I would imagine so. It's living tissue. It gets damaged, it can repair itself. Probably not very quickly.
Right.
But each of these sutures has names. So this is the suture that connects the frontal bone with the two parietal bones, and this is called the coronal suture. Why is that called the coronal suture? It's in the coronal plane. It's in a frontal or coronal plane. So this is the coronal suture. Then there is the suture that separates the parietal bones. This is called the sagittal suture because that is in the right mid-sagittal. It's right in the sagittal plane. And then we have this suture that connects the occipital bone with the parietal bones, and it's kind of this delta, this triangle shaped, and that's called the lambdoid suture because of its shape, lambdoid being this triangle structure. So those are the cranial bones. They form the cranial cavity, which has the bones, which has the skull inside of it. And then the other bones of the skull are called the facial bones. And these are the bones that form the structure of the face. This right here, the outside of the orbit into the cheekbone, this is called the zygomatic bone. Everybody palpate that, feel that right there. That's your zygomatic bone. Our nose is primarily cartilage, but if you work your way up a little bit, you'll notice that there are a couple little bones there. Those are the nasal bones. Okay, those are the nasal bones. And then this guy forms the main structure of the face. All of this here. And that's called the maxilla. And you can, palpate that all throughout here. And again, these are all held together by sutures. These are all suture joints. Then there's one other bone, one other facial bone, forms your jaw. That's the mandible. That's the mandible. And the mandible forms the only joint in the skull that is not a suture, that is not a fibrous joint. And what's the one joint in the body that has a lot of movement associated with it? I guess you wouldn't know the name of it yet, but that's this joint right there, and that's called your temporomandibular joint, or your TMJ. When do we use that? I'm using it right now. Talking, chewing food, all that type of stuff.
Something associated with that when you injure that, like.
Yeah, some people get inflammation in there.
Yeah, I think I injured it in wrestling. I was smacked down on the mat, and so now it pops all the time. Like I go to the dentist or the orthodontist, and they're like, "Doesn't that hurt?" And, no.
Yeah, and this is a synovial joint. So there's a fibrous capsule over it. It's filled with synovial fluid. All that type of stuff. Good. All right, so that's the skull. The next part of the axial skeleton is the vertebral column. And the vertebral column has a cavity running down the middle called the vertebral cavity. And what do we find inside the vertebral cavity?
Spinal cord.
That's where the spinal cord's at. Okay. The brain and the spinal cord are really precious, really sensitive organs, and so we want to have a lot of bony protection for them. So that's why we surround it by this bony vertebral column. There's a few different types of vertebrae. There's 7 vertebrae that run through the neck. And these are called the cervical vertebrae. C1, 2, 3, 4, 5, 6, 7. C1 through 7. And the first 2 are special, C1 and C2. That's the atlas and the axis. And we can talk about that later. But those are responsible for this nodding your head yes and shaking your head no are movements that are associated with C1, C2, the atlas and the axis. So 1, 2, 3, 4, 5, 6, 7. Then we get into the vertebra of the chest, and these are called the thoracic vertebrae, and there's 12 of them. T1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. And then we get down to the vertebra of the lower back, and there's 5 of them.
The lumbar.
Those are the lumbar. L1, L2, L3, L4, and L5. Then we get down next to this area called the sacrum, and these are actually 5 vertebrae that have fused together. Okay, but they're still considered part of the vertebral column. And then we have this little tailbone down below. That's the coccyx. How far do I want to get in depth with this? Well, first of all, these projections that are coming out the posterior side of the vertebrae, those are called the spinous processes. processes, and you can palpate those. So when you run your finger up and down your back, you're feeling those spinous processes. You have these little holes that are formed when the vertebrae stack on top of each other. Those are called the intervertebral foramen. And what's passing through there?
The spinal nerves.
The spinal nerves. That's how the spinal nerves get to the spinal cord. Then down in the sacrum, we have these holes called the sacral foramina. And what's coming out of those guys?
I know this.
That's where the sacral spinal nerves are coming out of. Out of these holes here, the sacral foramina. These vertebrae don't just sit on top of each other. There's a pad of cartilage that separates them. Those are your intervertebral discs. And does anybody know what type of tissue, what type of connective tissue forms those intervertebral discs? It's not bone. It's cartilage. Okay, it's cartilage. I think this would be worth doing. But here we have a disarticulated vertebra. So these are all the vertebrae that are separated from each other. And by the end of this, you're going to be able to look in here and differentiate one vertebrae from the next. This is the first one. Not C1, but this is one of the cervical vertebrae. And there's a couple ways that you can tell the cervical vertebrae from the rest. One, if you have them all out, they're the smallest. The cervical vertebrae are the smallest. Two, the spinous process is bifid. It's forked. So you see how there's a fork in the spinous process there? And lastly, and this is probably the easiest way, is that you have these holes on the lateral sides of the vertebrae, and those are called the transverse foramen. And so when they all stack on top of each other, like so, these transverse foramen, they form this canal on either side of the vertebra. And can anybody guess what passes through those transverse foramen?
Nerves.
Good. It's a good guess. It's actually blood vessels. Okay, blood vessels going to the head. So for the purpose of the video, we have this small cervical vertebra. We have a bifid or forked spinous process. And the distinguishing feature are these holes on the sides, which are called transverse foramen. This is the body of the vertebra. This is the main weight-bearing region. And then does anybody remember from the nervous system what we call this hole in the middle of all the vertebrae? That's just called the vertebral foramen. And you know, all the vertebrae stack on top of each other, and that forms the vertebral canal that the spinal cord runs through. This is a thoracic vertebra. It's a little bit bigger than the cervical vertebra. The body's a little bit larger. No, the spinous process, there's no fork in it. Okay, no fork in it. And it's also missing those transverse foramen. But really kind of what stands out about these thoracic vertebrae, and I'm going to change it up, I'm going to use this guy instead, is they have this long pointed spinous process. Okay. And I have a picture of this side by side, but this actually looks like an animal. Looks like a giraffe. Okay, you may not see it now, but you hold this up to a picture of a giraffe, and it looks like it. You have the nose, you have these horns coming up, and then you have the ears on the side. So a thoracic giraffe. And then lastly, we have the lumbar vertebra. And these are the largest. Okay, the body of the lumbar vertebra is really large. And why is that the case? Why is it that the lumbar vertebra are the largest of all the vertebrae?
Isn't that where most of the weight sits?
Yeah, so the vertebral column holds the weight of the upper body. And as you get further and further inferior, you know, there's more and more weight to hold. So there's more weight on the body of those vertebrae. The spinous processes of these lumbar vertebrae are more hatchet-shaped. Okay, they're not pointy. And when you hold this up to a picture of a moose, it actually looks like a moose. Okay, a lumbering moose. And the nose, the horns, and the ears. Good. So how are you going to remember that there's 7 cervical vertebrae, 12 thoracic vertebrae, and 5 lumbar vertebrae? Well, maybe you eat meals at 7 in the morning, 12 in the afternoon, and 5 at night. That's one way to remember it. All right, onward. The next part, and the last part of the axial skeleton, is the thoracic cage. And yeah, it's a cage that makes up the chest. What are we protecting here? Why do we need this cage that surrounds the chest?
We're protecting the heart and the lungs.
The lungs and the heart. Exactly. Those are the main things we're protecting here. And the thoracic cage consists of the thoracic vertebrae. Well, I'm going to start from the front. Most of the cage is formed by the ribs. And there are 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12 ribs. The first 7 ribs are considered what we call true ribs. 1, 2, 3, 4, 5, 6, 7. Then the next 3 are what we call false ribs. 1, 2, 3. And the last 2 are what we call floating ribs. Okay. And most of those ribs are going to attach to the anterior portion of the thoracic cage, to this bone right here. And what is this bone?
The sternum.
That's the sternum, also called your breastbone. And this little notch up here is called your jugular notch, and you can palpate that. This is your jugular notch. And we can divide the sternum up into 3 different regions. This upper part is called the manubrium. This main part is called the body. And this little projection down below, which you can also palpate, is called your xiphoid process. And that's a landmark for CPR. And you get in there, you feel the xiphoid process, and you go above that to the body of the sternum. Because if you do CPR in the xiphoid process, then it can break that thing right off. Okay. Now the ribs attach to the sternum, but they don't attach directly. They attach by this type of tissue. Can anybody take a guess what type of tissue attaches the ribs to the sternum? It's cartilage. And we call these the costal cartilages. Each of these true ribs have their own costal cartilage that attaches it to the sternum. And then you get down here to the false ribs, and you have the costal cartilage that comes up, and then it merges with the cartilage from the true rib above it. And so that's why it's called a false rib. It doesn't have its own costal cartilage connection to the sternum.
So why are those last two called floating ribs?
Well, they're just floating there. They don't attach at all. So there's no cartilage that attaches it to the sternum. Okay. All right, and then lastly, I want to introduce the appendicular skeleton. And like I said, appendicular appendage is something that you attach onto the axial skeleton. So the appendicular skeleton consists of the bones of the upper limbs, the bones of the lower limbs, and also the bones that attach these limbs to the axial skeleton, and we call those girdles. So let's start at the top. Let's start with the bones of the upper limbs. Okay, first of all, everybody get in the, at least for the upper body, get in the anatomical position. And the anatomical position is standing upright, feet slightly apart, and the palms facing forward. So your thumbs are facing out. And that's what this skeleton is in. It's in the anatomical position. Okay. So we have this region of the arm is called the brachial region. And there's one bone in the brachial region. What bone is that?
Humerus?
That's the humerus. Yeah. That's the humerus. And then we have two bones in the antebrachial region. We have one that runs lateral. This is called the radius. Okay, it runs along your thumb. Radius, rad, thumb, something like that, you know, whatever it takes. So this is the radius, and then this is the ulna. Then we have the bones of the wrist. These are collectively, they all have a special name, but they're collectively called the carpals. Then we have the bones of the hand. Those are called the metacarpals. And then we have the bones of the fingers. Okay, the bones of the fingers, and those are the phalanges. And all the fingers, excuse me, with the exception of the thumb, have three phalanges in them. You have a proximal, a middle, and a distal phalange. And that's why you can move your fingers, you can bend them like so, is because there's joints. There's three bones there, and there's joints. All right, so up here at the humerus, let's see. Well, there's two bones that attach the upper limb to the axial skeleton. This is one of them right there. That's your collarbone, or more specifically called the clavicle. And you can palpate that. Start in the middle at your jugular notch, move laterally, and you can feel it has a curved feel to it, and it comes all the way out, and it attaches to this bone in the back, which is the scapula. Okay. And it may look like the scapula is attached to the ribs, but it's actually not. There's layers of muscle underneath there. So the scapula is free floating on the back. And that's why you can have such a good range of motion back there partially, is because that scapula moves across the back, up and down, side to side across the back. this joint right here, this is called the sternoclavicular joint because it attaches the sternum to the clavicle. This is actually the only location where the upper limbs are attached to the axial skeleton. Okay, there's no other bony joint that attaches the upper limbs to the axial skeleton except that sternoclavicular joint. Okay. Let's just go through some main joints. Here we have the head of the humerus, which fits into this portion of the scapula called the glenoid cavity, and that forms the shoulder joint. And that's a synovial joint. There's a joint capsule over it. It's filled with synovial fluid. There's pads of cartilage on the end of these bones. And there's a lot of movement associated with the shoulder joint. And from a structural perspective, you have the head of the humerus, you have a ball, and it's sitting in this kind of cavity in the scapula. You have a socket. So that's called a ball and socket joint. And there's a lot of movement that can take place at a ball and socket joint. The most movement in the body occurs at these ball and socket joints. Then we get to the elbow joint, and the elbow joint is formed by the humerus and the ulna. Much more limited range of motion. You have flexion and extension. This is called a hinge joint. Then you have all these different joints down here in the wrist and the fingers and all that kind of stuff. Okay. Question about the upper limbs. Then we get down to the lower limbs. And what I want you to notice is that the body plan for the upper limbs is the same as the lower limbs. So this is the first part. This is the femoral region. And there's one bone that runs down the femoral region, which is the femur. So there's one bone in the upper part of the arm. There's one bone in the upper part of the leg. Then we get down to the, man, I always get this mixed up. Is it the crural region, I believe? The lower part of the leg. And there's two bones here. We have one that runs medially. Anybody know what this one is? That's the tibia. And then we have this one that runs laterally, which is the fibula. And the tibia is a good bone to palpate. Right at the top here, you have this bony projection called the tibial tuberosity, and you can palpate that. Right below your knee, that bony bump is the tibial tuberosity. And there's a bunch of major muscles that cross the knee and attach to that tibial tuberosity.
And that's a hinge joint, right?
This is a hinge joint as well. So just like the upper and lower part of the arm is connected by a hinge joint, the upper and lower part of the leg is connected by a hinge joint. Yeah. Another part of the tibia that you can palpate is this smooth, what's called a medial surface. And this is your shin. There's no muscle that runs across your shin. When you hit your shin against something, it hurts. Yeah, that, because there's no muscle there. There's no padding. That's just straight up bone. And then these come down, the tibia and the fibula come down, and they form the ankle joint. Now, a couple other parts of the tibia and fibula that you can feel. You have this bulge on the medial side of your ankle. That's called the medial malleolus, and that's part of the tibia. And that's this medial ankle bulge. So you guys can all feel that. That's part of your tibia. And then the fibula has the same thing, but on the lateral side, and that's called the lateral malleolus. And that forms the other ankle bulge out there. Okay. Then both of those articulate with the bones of the ankle, which all have special names, but collectively they're called the tarsals. Then you have the bones of the foot, which are called the metatarsals. Then you have the bones of the toe, which are the phalanges. And guess what? Every toe has 3 phalanges except the big toe. And this guy's actually had his big toe severed, unfortunately, but there would be two bones there. One thing I didn't mention, this girdle that attaches the upper limb to the axial skeleton. This is called the pectoral girdle. This girdle down below that attaches the lower limbs to the axial skeleton, this is called the pelvic girdle. And it's formed by the pelvis, also called the hip bones, also called the os coxa. And there's 3 different regions of this because when you're young, these are actually 3 different bones and then they fuse together. But there's the ilium region, there's the pubis region, and then there's the ischium region
At
on the
what
back.
age do they fuse together?
That's a good question. I don't even know if it's not in utero. I think it's postpartum. Young. I'm going to guess a couple of years.
Okay.
I'm not sure. Certainly, I think before you're like 10 or 12. or
Okay,
something.
because I misaligned my pelvis when I was 16, so my pelvis isn't symmetrical.
Okay. Yeah, that probably has to do more of the whole thing shifting
Yeah.
instead of the individual bones. Yeah. All right, and then this right here is called your iliac crest. You can, if you dig deep there, you can palpate that, your iliac crest. Maybe some other time you can get down there and palpate your pubis. And then you have this part of the ischium in back, that's your ischial tuberosity. And you have big gluteus muscles that wrap over here, but when you sit down, those gluteus muscles move out of the way, and those are the bones that you're sitting on. Those are your butt bones, I guess. Yeah, those are the bones you sit on.
So when they say you have a bony butt, that's what they're.
Yeah, you have a
Okay.
big ischial tuberosity. And then let's look at the hip joint. This is the hip joint. And guess what? Just like the shoulder joint, it's a ball and socket joint. Lots of movement associated with this. And this is comprised of the head of the femur with this cavity in the hip bone that we call the acetabulum. Put your ass into it, type of thing. It's spelled acetabulum, but it's called acetabulum.
What's the hip bone? Like,
What? It's this whole, so it's paired. There's one on this side. It's this whole irregular shaped bone right here. And they're linked together by this pad of cartilage called the pubic symphysis, right in the middle.
And then that can separate, right? But that's really painful.
Yeah, childbirth.
Oh. Okay.
And so the pelvic girdle, the hip bones, attach the lower limbs to the axial skeleton, and they do that right here at the sacrum. And this joint that links the ilium portion of the hip to the sacrum is called the sacroiliac joint, or the SI joint. And I personally have had pain and misalignment associated with that SI joint, and it takes physical therapy and kind of building up these muscles around the butt to kind of compact it in there and hold it where it needs to be. Okay, that's a good start.